Our next conversation is about bridging care gaps and empowering health workers for global equity. So please welcome back to the stage Magee Ducharme. She's going to moderate this next discussion.
Hello again. Sorry to those of you who are at the prior panel. I will introduce myself again. My name is Magee Ducharme. I'm a health correspondent at Time Magazine, and I'm delighted to be here for a conversation about empowering health workers for global equity with Kristie Magee Porcaro of Operation Smile.
Thank you, Jamie.
Of course. So I'll give you all just a little background on Operation Smile's work. For the past 40 years, they have worked to bring sorely needed surgical, medical, and dental care to people in more than 30 countries around the globe, predominantly low and middle income. Just as crucially, Operation Smile works closely with healthcare workers in those countries to meet their unique needs and help build sustainable health systems moving forward. Roughly 80% of the medical volunteers who work with Operation Smile are healthcare workers from the areas in which they work, and many of them have received education and training from the organization. Kristie Magee Porcaro, Chief Strategy Officer at Operation Smile, is here today to discuss the importance of expanding access to care, of nurturing future generations of healthcare workers, and the wide-ranging effects of that work even beyond the medical system. Thank you for being here.
Yeah, thank you, Jamie, very much. We're excited to be here. Just a little bit about my background. I started with Operation Smile when I was 6 years old. I watched the organization grow up, and it was a moment for me at 10 years old when I got to experience a surgical program that really made me want to keep coming back. It was the last day of surgery, and we were packing up to leave after 5 days of surgery. And I remember my brother Trevor and I sitting on the stairs and crying. And my dad, who's one of the founders of Operation Smile, came over and he said, "What are you crying about?" And we said, "Who's going to take care of these children and these patients when we're not here?" So fast forward 41 years later, I have a nursing background and also did some consulting before I came on 19 years ago, and just so proud of where this organization is. For us, it's about 41 years later pushing into the communities where our patients work, understanding the health needs, understanding the lack of access of safe surgery, all really important as we look at the future.
So in those 40 years and the many decades that you have worked with this organization, how have you seen its mission progress and evolve?
Sure. I think I hope people understand that, we do more than just surgery. Right? For us, it is about really making sure comprehensive care is given to all of our patients, that educating our medical volunteers, all volunteers, is also really important for us for the future. But I would say it was the pandemic. Look, there were things that happened that were really terrible, but for us, it stopped us in our tracks. It got us to really rethink where we wanted to head for the future. We partnered with our foundations in the 36 countries that we're in, and we said, "What do you want for the future?" And they were the ones who were doing the work really when the pandemic was going on. So we co-created a strategy to take care of 1 million patients in the next decade, but about surgery, but also about the education, the training. Women in medicine is a huge platform, helping our patients that are coming over the borders from different countries. How do we provide care so that our countries can do more?
Right. And it strikes me as so unique that Operation Smile truly forms these partnerships with people on the ground in the countries in which you work, as opposed to just flying in to deliver care. Can you talk about how those partnerships help further the organization's mission and help improve health delivery in those countries?
Sure, and I think everyone has been a part of just the earthquake in Morocco, and it's a perfect example of partnerships. We have a foundation in Morocco, and so what did we do? We were flexible. We said it wasn't about surgery; it was about equipment and supplies. Right. That we got to, a lot of the devastation that happened around Marrakesh and at the epicenter of the earthquake. And so for us, supplies and equipment was so important. So what did we do? We reached out to our partners like Johnson Johnson & Johnson, and other partners that exist around the world. And we got supplies immediately for them in Morocco. So that's just one example. Another example is we partner with ministers of health in all of our countries. In Rwanda, we're really trying to elevate, healthcare within those communities. There's 2 plastic surgeons a couple years ago for 12 million people.
Wow.
So can you imagine?
Yeah.
And it's not just about, it's about trauma, it's about burn. So partnerships with the Minister of Health, with the WHO, with the universities locally are really important for us. COSEXA we work with. So now in a country like Rwanda of 12 million people, now they have 5. So they have 5 surgeons, and we're training another 6 alongside universities, ministers of health, corporate partners. So we couldn't do what we do without partnerships. It is the key to really make sure that there isn't lack of access, and that we're educating and training not just around the surgeon. We call it the big 5. So the anesthesiologist, the nurse, the pediatrician, the biomed tech, those are just examples of, some of the healthcare providers that are important to train, so that when Operation Smile isn't doing the work that we do, that safer surgery is provided for those communities.
Right. Those are such powerful examples. Thank you. And I also wanted to talk about, why surgery? Why is that such an important place to start in this larger conversation about expanding access to care?
Sure. I think, we see so much financial burden on our families, right? And on our patients. And so, if we can provide surgery, think about what we're doing for those communities. People can go back to work, right? And so for us, it is important to bring care closer to our patients and our families, because if we can provide that surgery, then they can go back and do the work that they need so that that system can be elevated. So as an organization, our hope, working with the WHO, is to provide service 75 kilometers from where our patients live within those communities. So, we always say that sometimes it's really important to look at people's feet in the work that we do. And it sounds interesting, but the reality is that when you look at people's feet or you look down, you can see that maybe they don't have shoes, or maybe they don't have the care that they need and is provided. And so they walk these long journeys to get to surgery, but then they're turned away. So if we can provide it closer to where they live, then they can go back and provide for those communities, elevate the health system, but also alleviate the financial burden on their families, but on their communities and on their countries.
Right. Yeah, that's such an interesting point, sort of the trickle-down effects that having this access to care can have. Could you talk a little bit about the benefits to entire families and entire communities when you broaden access to care?
Sure. We see families all the time, right? And for us as Operation Smile, when we go into these communities, it is about the family, right? So, we in Madagascar, just last week, where we ran a surgical program, we provided psychosocial, not just for those patients, but for the parent, for the children, and also for the family members that were there. We provided also breastfeeding training camps for moms, of new moms, to teach them how to breastfeed their children. We also provide comprehensive care so that they see doctors, nurses. We provide communities for these patients to come into. So yes, it's about the patient and their families, but it's about the whole family and the whole child. And I think that's why we're so proud as an organization. But partnerships also mean a lot to us. And so when we're in these communities, it's important to also collaborate with other organizations.
Right. Sort of in that vein, you spoke about how the pandemic was, for obvious reason, a huge challenge in the work that you do, but also in local health systems. Could you talk about what the big challenges are that are facing some of the health systems in the countries where you work?
Sure. I would say access is really key, right? So our patients and our families just don't have access. For us also as an organization, it's also important to train local people because, right, they're more comfortable in their native language. Sure. And so for us, it's important for partnerships within those communities. So an example would be in Colombia. We've worked in Colombia for close to 30 years. We partner with a lot of organizations, UNHCR being one of those, and we work within a migrant camp. And one of the examples would be one of the women from the migrant camp is now a volunteer of ours, and she speaks Waju, which is their language. So you think about when a patient meets somebody who's local, who speaks their language, they're not afraid. Right. And so with that, then we can communicate with those families what is the need, where is the need, and how we can help them to provide that need in surgery.
Right. The volunteerism element of the organization is so powerful to me. I mean, just this morning I had the opportunity to meet a young woman who volunteers with you and had benefited from surgical care when she was a child.
Sure.
It must be so rewarding for you to get to see sort of these full circle experiences like that.
Yeah. So my parents always believed in volunteering. It was really important for them, even when we were young as kids, to bring us on the surgical programs with them. Yes, you met Laura from Panama, who's a student who's volunteered with us for 4 years. But I think we have 6,000 medical volunteers. We've trained about 1,500 new volunteers this year and educated and trained them. It is, who this organization is. But it's not just about medical leaders. It's about students. It's about youth empowerment. And for us, we always say it's the next generation of leaders, so that if we can inspire them or touch them in a certain way, really to make them want to change the world, we say, even if it's through Operation Smile, great, but if we've inspired them to do something good for another organization, we as an organization have won. But important to give back, important to teach others. And for us, we're so proud to be a volunteer-based organization for 41 years.
And you spoke especially about the importance of training and educating girls and women. Why is that such an important place to focus your time and energy?
Sometimes, women, unfortunately, are kind of in the back of, trying to, create change in this world. We talked this morning on a panel about, how sometimes women do everything, right? They're the moms with the dads also by their side, but we try to take on so much. But for us, it is about training this next generation of leaders, giving them the ability to do what they want to do, be a part of the healthcare force. One of an example of a recent excitement for us is in Rwanda. They trained their first ever plastic surgeon. In a country, like I said, of 12 million people, Francoise will be the first one. And for us, to have a Francois to inspire other people is important so that we can really look at this gap in education and training for all women out there and for them to be providing and leading these roles in the future.
Right. And as someone who has been, really for your entire life involved in this work, I would love to just close with a little look at the future, kind of what you see as the next frontier for both Operation Smile and for the larger fight for global health equity.
For the future, I think it's about you all. I mean, we're all here. Concordia really does that. It's about collaboration. For us, after 41 years, we still remain a global family. We partner, but my dad always said emotion leads to action. And for us, we say if you're touched by something, do something. And there aren't monies to go around for all of us these days, and for us it's about looking at the future. It's about collaboration. It's about where are the strengths that exist around the world, where are the challenges, where can we partner. 41 years later, we know the need. We've been to the communities, we've served the population, we've been there for our patients and our families, but I think this world needs more partnerships, more collaboration. Leaving, we always say, your ego at the door so that we can really look at elevating these health systems so our patients and our families, no matter what organization you're working in, don't have to walk those long journeys. So today is about partnership and about collaboration. So I always say, if you meet somebody here at Concordia that you've been moved by, then do something. Operation Smile is always welcoming. We partner with UNHCR. We partner with IOM and UNICEF and Save the Children, but we really welcome other partnerships globally around the world to really make a difference, change lives, create more smiles for this world, and really just to make a better place.
Right. Yeah. Partnership is the theme of the day, but always such an important thing to keep in mind. So I want to thank you so much for taking the time to be here and have this conversation. And thank you all for listening.
Yeah, thank you.